All right, it's time to get your medical questions answered.
Dr. Zorba Paster standing by, 270-9933, the number to call. We'll start with Steve from Wanakee. Hi, Steve, what's your question?
Yes, I have a grandson that for the last 6 months has been pretty sick, off and on, lost about 15 pounds, hand lab work done lately, and his platelets are extremely high and his white blood count is elevated. What's your thought?
Oh, my thought is something that really can't be answered on television, can't be answered on the radio. Very important, if they can't find it, to get a second opinion. Any child that's lost 15 pounds, it's got to be something serious, either something serious from a point of view of depression or something serious that's physiological. Make sure that he gets the right care. Make sure he gets his second opinion.
Oh, and best of luck to you. Thank you for calling. Let's go to Mary from Sun Prairie. Hi, Mary. What's your question?
Hi, it's in regards to the flu shot. Is it true to wait till the end of the month for a flu shot because there would be a stronger dose?
No, I think the flu shots, anytime now, anyone can get a flu shot. If you're over 65, you get the stronger dose flu shot. You should wait for that if you're over 65. If you're under 65, you get the lower dose flu shot. And the reason is old folks don't produce enough antibodies, and that's why it's a super shot for them.
But it doesn't matter when you get it, right? So
not at all. At this point now, anyone, and frankly, you want to get a flu shot. If you never got one this year, make sure you get one, because we won't necessarily be able to tell the difference with some of the symptoms between influenza and COVID. And frankly, you don't want to get influenza and COVID. That could be a deadly combination.
Get your shot. And it'll last for the whole season.
It lasts for the whole season, yes.
All right, let's go to Barb in Portage. Hi, Barb.
Hello.
Hi, what's your question?
Yeah, I fell, and I'm just trying to make sure I get the proper
All right, she's got
trying to get the proper care.
I think maybe her television.
I think the television had feedback.
Yeah.
But once again, if you want to get proper care, you go to either your physician assistant, nurse practitioner, or family doctor. And if you're ever concerned, getting that second opinion, like we said with the first call, can really make a difference and certainly put your mind at ease.
So what are some simple things other than the throw rugs, picking up the throw rugs, can you do around the house to prevent falls?
Lights around the house, making sure that you have that. Making sure, especially if you're a man, not to get on ladders, because often men get on ladders when they decide they're going to clean out the gutters and fall off the roof. I can't tell you, or they're pruning the trees. I mean, it's a very common thing where all of a sudden they're up 6, 10, 12 feet, and then all of a sudden they get a little bit unsteady and they fall down. So if you're going to get on a ladder, make sure you're really secure. And if you're older on a ladder, think about whether or not you want to have somebody younger actually do that. That's a big issue, especially in Wisconsin, where leaves will fall.
Yeah,
yes,
that's
exactly.
Right. Let's go to Nancy in Madison. Hi, Nancy. What's your question?
The question is it unhealthy to stay inside too much during the COVID threats, or just to avoid other people?
Well, I think you should definitely go outside. Today was a beautiful day. It was a beautiful day. My wife and I went for a walk today in the dog park in Verona. It was wonderful. You want to get outside. What you want to do is socially distance, 6 feet away from people. And if you're unsure, wear a mask, but definitely go outside. Do not stay inside. The issue is don't go into places where you're going to commingle with people and you're going to be too close. If you're going to go to the grocery store, make sure you wear a mask. Just use sensible ways of reducing your risk for COVID. But it's important to be outside. Autumn, September, and October, beautiful months in Wisconsin. Take advantage of it.
Get some vitamin D at the same time through the sun.
And vitamin D, you bet.
All right, let's go to Jenny in Sun Prairie. Hi, Jenny. What's your question?
Hi. You guys were just talking about the flu shot, and they said if you get it now, it's good for the entire year. But I thought that it was only good for 6 months.
the CDC looks at this and generally is good for the entire year. It's not all of a sudden it's 6 months that it drops. It's really that you want the flu shot on board when influenza strikes. And we don't know exactly when that's going to be. The good news is that in Australia and New Zealand, where influenza generally starts, it has not been a big flu season because people are wearing masks. So by wearing masks, we reduce influenza. So this year, it might not be as bad as we think, but still, everyone should get an influenza shot, and now is the time to get it whenever you can.
Susan got hers on Monday. I'm getting mine tomorrow. So we're good to go. All right, Zorba, enjoy the weekend. Thank you all for calling. Thank you all for calling in. Good questions.
Yeah, thank you for your time, Zorba. Great to see you.